Dr. Vikas Mittal.
Thank you so much, Dr. Basak, and lovely to be here. Thanks so much, All India Ophthalmological Society. So what I am going to do is I am just going to brief what we all cornea surgeons have seen in last 1.5 year. So when this COVID will be over, I'm sure that this memories, these figures will be there somewhere in our mind. We all will have these memories of our own cities which have been deserted. The ophthalmologist, as an ophthalmologist, we will also be having this thing in mind, which we have done in all our setups: the thermal screening, the hand sanitization, the PPE, the shields, digital payment, social distancing. We all have done this to ensure that we as well as our patient stay safe. The different kind of PPEs that we have learned during this time, the mask, the online consultation just now Praveen has mentioned. So this thing will be there in our mind when we will in this COVID will be over. And this is a sign that the human race is quite resilient and we tend to come back very fast. When the COVID came, there was blank, and then the eye surgeons around the globe started deliberating, started publishing to help the peers how best we can do. And whatever publications came, cornea was quite highlighted in all, because suddenly there was no cornea tissue at all. You could do a hypermature cataract, but if there's a corneal melt, there's a bad infection, there's no cornea, and that was a really very challenging scenario. The leadership at All India Ophthalmological Society was very aggressive, very proactive in providing all the protocols, first for practice and then for eye banking, and how best we can retrieve these tissues. To know what was the actual impact, I called up Ganesh at EBAI yesterday, and look at this. Pre-COVID year, the total number of cornea retrieval in India were 50,000, and in COVID year it was 11,000. The reduction by 77%. And then transplant also from 27,000 went down to 8,000. So this, because there was no retrieval, obviously the cornea surgeon all over globe, all over India have found this challenge. This happened all through. It's not just India, it's happened all over globe. And what we did, how did we come back? We started using the tissues very sparingly, use glycerol preserved tissues also, and whatever tissue are available, that eye bank as well as cornea surgeon ensure that gets utilized well. And look at this map again. Utilization improved in this particular COVID time because we wanted to ensure that all tissue get utilized well. There was lack of transport of medication. I remember one patient who had acanthamoeba and we couldn't somehow get PHMB chlorhexidine, somehow manage with chlorhexidine, mouthwash, and maybe voriconazole. So these were the challenges which we faced. So what we did for the corneal perforations, we came back to our using our drape or sheet, gluing it with cyanoacrylate glue, and not only just cyanoacrylate glue, we also used multi-layered amniotic membrane grafting, and then using fibrin glue. So thankfully we had some fibrin glue in our stock. That was also a challenge. This tenon patch grafts. So we tried to use whatever things were available, the Gunderson flap, the tenon patch graft, to ensure that we could somehow save these eyes. So as I said, that to bounce back, we tried our level best to, as a cornea surgeon, whatever best we could do. The teleconsult, Parveen has highlighted so well. This was also an innovation of this time. Even we found that there were so many corneal transplant patients which can easily be followed on this teleconsult. I give you a very small example. So this was this 44-year-old pulmonologist. I had done DSEC for her for a failed PK graft 2 years back, and she was doing fine. I remember her graft was very fine, and she had a COVID positive, became a COVID positive, and 3 days after she became COVID positive, she called me and said that, "Doctor, I am having a blurring of vision." So I told her to send me her photographs, and these were the photographs. There was clear-cut rejection. I remember that graft was very clear, and suddenly there was edema. So since she was a pulmonologist, I told her that we need to give IVMP immediately. She arranged the IVMP steroids, and then after 2 weeks, she said that I'm feeling far much better, and she sent me another photograph. You can see the cornea graft got clear. So just on teleconsult, also, we could manage this well, and she was very happy, and she said that, I have taken these steroids, and now let me know what all to be done. So the basic issue which we found in COVID days was lack of corneal tissue. That was a major challenge. And but we as I said, alternate techniques of saving the globe, and then the teleconsultation. These were the innovation which we found that was very helpful. So as I said in the beginning of my talk, the human race per se is very resilient. No matter what challenge are, we definitely will come back and bounce back with very good colors. Thanks so much.